So over to Dr. Rijita Trivedi to moderate today's session. I'm inviting Dr. Rijita.
हाँ,
Yes.
okay, sir. Thank you, sir, so much.
Please open
Uh,
your video. Dr. Rijita, please open your video first.
Actually, sir, I am taking from laptop and its camera not working.
Okay.
Can I start? Sir?
Yes, you can start now.
Okay, okay. Good evening to all and a warm welcome to all IFPH member, homeopathic doctor and students. Today is our 2034th day of uninterrupted daily webinar of IFPH on 27 March 2026. And our today's guest is Dr. Amit Gunin, and he is MD Homeopathic. He is coming for the first time, so a very warm welcome to you, sir. And he has very much experience, and he is assistant professor, Department of Organ of Medicine, Metropolitan Homeopathic Medical College and Hospital in West Bengal, and in Golden Jubilee Seminar of HMAI, Organizing Committee member in post of Joint Office Secretary. And his today's topic is mental health and mental hygiene. Uh, Sir, I am inviting you. Please, you can start your presentation.
Sir, you are co-host.
Uh,
Yes, sir is co-host. You can open the
Sir,
video. Yes, sir. Please open your video. Sir,
hello,
yes, sir.
hello, sir.
Yes.
I cannot join in my laptop through my laptop. I try to join, but I cannot proceed from the laptop. Can you help me, sir, to join from it?
Yes, you met. If your network is good, you can join from the laptop also. If you have any difficulty, you may do one thing. You may send the video, the PPT now to me, so that I shall arrange another person to
Okay,
share.
okay, sir. Okay, sir. I will send you, sir, the
Okay,
PPT.
Dr. Binoy will share. Once you send it to me, I shall send the same to Dr. Binoy, and Dr. Binoy will share it for you. You are trying from your laptop?
Yes, sir. I am trying from my laptop, but
Okay. I shall arrange it. Please wait one minute. Okay, I shall send it to Dr. Binoy. Yes, yes, I have sent it to Dr. Binoy. Binoy, you can. Anyway, you may begin the session in between. Dr. Binoy will share. Okay, you can say this
sir,
introduction.
uh,
Okay.
I my PPT. There is my PPT.
Yes, I got it. I got it, and Binoy will be sharing shortly. Sometimes, if the network is not proper, laptop will not.
No, sir. Previously, I can join from this link, but
The same. All the links are same. There is no change in the Hindi session or Malayalam or in English.
Yeah,
We are using the
okay,
same
sir.
link.
yeah, it will be sharing in a minute, in like few seconds.
Okay.
Okay, sir.
Yep.
Sir, may I start?
Yes, you can.
Or
Yes, you may start. You can say the introduction in between. Dr. Binoy
okay,
will
okay, okay,
share.
okay, okay, okay. Thank you, sir. Thank you. Thank you giving me this opportunity.
Please unmute. You are muted. You are muted.
Yes, sir.
Dr. You are muted. No, okay. Now it's fine. You can talk.
Oh, sir, thank you, sir, giving me this opportunity for presenting this topic. Uh, Today's topic is mental health and mental hygiene, and which is very important in our life. Good evening to all respected participants. Uh, सर वो स्लाइड आ गया है अभी
Yes, yes. Can you
कैन यू
show,
प्ले दिस
can
ओके
you see?
ओके
Okay. The
okay
slide
okay
is
sir good evening to all respected participants. Today's topic is vast and familiar to of many of us, yet it is deeply meaningful, and it will be humbly try to justice to it, and together we will revisit and reflecting its importance aspects throughout this seminar. Now, come to come to the seminar. First, why we study the mental health. Sir, previous slide, please. Don't change the slide, please. While I telling you, then only change the slide. Okay, sir. Why mental health is matter today? We all talks about the care of the health care, but missing missing of the health mental health, it is incomplete, and we most of the time ignore the mental health. And now in house I have an questions, as a patient comes with a migraine, but while we case taking, and we find that she tell I am feel alone, and cry at over the night for the several nights, nobody understand me. Then it is only the case of migraine or associated with the mental health problem expressed through our body. And another thing, also tell that if there is a no headache and no cough symptoms, no other physical complaints, and no pathogenetic detection or pathogens is detected, but person has suddenly avoid to talk others persons, and they do not take their regular foods, and they keep quiet in itself, and appetite become lost, and sleep not adequately, is a condition of healthy. So this is the very important question to ask. Only physical complaint is there, or mental health is an important role play? So that is why today's mental health topic is a very burning topic. And now, next slide, please. Why why it is a so much burden today's scenario? According to the World Health Organization, and there is a 2443 is a disability life adjusted year per 10,000 population in our India. Suicidal rate becomes 21.1 in 1 lakh populations, and mental health condition between 2012 to 2030 approximately estimated at USD 1.03 trillions. And because our India is globally populated is more, or they contribute it 18% of our populations. That is why it is an important role play, that figure showing the very little, but in bigger scenario it is a very much number. That is why it is an issue. And according to the NIMHANS, found that 10.6% of the adults of Indian suffering from the mental health disorder. Most of them is the mostly denoted that the treatment gap. 70 to 92% people are not or reported it or received the mental health related issues for the treatment due to the lack of awareness and stigma, and shortage of professions. Next slide, please. Now, uh, before going to the mental health, we considered, according to the World Health Organization, the health definitions of the health. Definitions of the health state the a state of complete physical, mental, and social well-being, and not merely an absence of the disease and infirmity. Here we clearly seen that the mental health is one of the key point of the health. Without mental health, it is the incomplete of the health. Mental health is a balance between the individuals and surroundings the world surroundings world. It is not an so difficult to understand. And if I tell you that one cheap examples like that, we all are used smartphones. Uh, the smartphones having the good screen display and good battery backup and good camera. It is, but if we see that their processor or software become hanging and crashed, the apps of and the maintenance of the phone's services become totally disrupted. And that is why is here also it's like an and that the screen display and the battery backup and camera all are the like the physical health of our system. As software and mental health is as same in like the our software of the mind. Now, another question, and if we uh, if we quarreling with our any close person or family member, then what should be happen to in your mind? What that time happened, and that is an issue. Without being an always the pathogenetic or in disease affection, our health become the change with some behavioral changes we can see in it. Now, next slide, please. Now coming to the definitions of the mental health. According to the circle, the adjustment of the human being to the world or to each other is maximum effectiveness and the happiness. The according to the WHO, mental health is a state of mental well-being that enable people to cope with the stresses of the life, realize their abilities, learn well and work well, and contribute their community. And according to the American Psychological Association, and a state of mind characterized by emotional well-being, good behavioral adjustment, relative freedom from the anxiety and disability of the symptoms, and a capacity to establish a constructive relationship and cope with the ordinary demand and stresses of life. That is the definitions of the mental health. Hope all are the understood what they are the want to say. Uh, our mental health, how much important role play in this in our health. Next slide, please. Now, it is here that we always denoted that mental health related to the mental disorder like schizophrenia, OCD, or other diseases. Not always needed that disease pathology only needed for the mental health purpose. The hopefully we understood in being of the disease without disease there is the mental health is a most important role play. Okay, next please. Now Mary Joda proposed in 1952 regarding this mental health concept that the our mental health will become how positive thinking may be possible. That is why he give the component and six criteria regarding the mental health. Uh, that is the just self accentualizations of the growth. uh, there is a sir, please click slide will be animation is there. Okay, the first is the positive attitude towards the self. Second point is the self actualizations and the development. Third one is the intricacy. Fourth one is the autonomy. Fifth is perception of reality. And sixth one is environmental mastery. Now we study the all 6 points and how concept of mental health help us to maintain our mental health situations. And we try to touch with some few homeopathic point of view also in few regarding medicines, and we try to level our best regarding this. Next, please. Now, positive, uh, positive health towards the physician. Positive health is positive positive attitudes towards the self. It is in this is the objectives is the identified by the own self, their state, what is the his strength or his or her weakness and limitations. The individuals feel strong sense the personal identity and security of environment. uh, Here we see that most of the time, if there is any type of the quarreling in anywhere, we see that there is a we try to blame each other rather than the we accepting our faults or what is our good in ourselves. That is the main motto, that the positive attitude was to self, to recognize, don't blaming to others, to find out the what is the cause and what is the strength and what is our negligence, and what is the acknowledge our mistakes and limitations. That is the knowing by ourselves. Okay. Here we see that who are the those person, and who are is deprived or distorted from this attitude. We see that they have some patient may say as a I am useless and the self-hearted and the feeling something inferior. Most of the people think about the negative thoughts. So here we can and help with our medicine, and we have several rubrics in our Kent mathematical, just like the rubric of the as negative thoughts. So rubric jumping from the heights. It's here we find that aurum metallicum, argentum nitricum, staphylos aureus, anacardium, and gelsemiums, and others medicines. Here here maybe I think so that rubric may consider, due to the inferiority and the self guilt feel, the person and like aurum metallicum may interpret it as a dreams, or think that the inferior and the jumping from the height, it is maybe a delusions that they are position of the losses, that is maybe an important role. And others, here we connected with the organon of medicines is with the aphorism 3, that the physician must know what is to be cured. That is the most important point. What is the main point to cure the patient? And as per the 211, we see that aphorism, the mental symptoms is the disposition is chiefly guide the selection of the medicine in homeopathy. Next, please. Next is the self-actualizations and the growth and development and achievement of the tasks. Objective of this is achieve the tasks associated with the each level of development, and that the person can set their goals and they can fulfill it, so that while we completing our tasks as per our goal setup, we getting some confidence in ourselves, and also we are motivated for do more things also. While in different ages our set of goals is the different. At childhood we are concentrated with the most of the time of with our studies, and adolescence, and then middle life and old age, the several ages, with the several goal setup. While we see that the disrupted on this thing, lack of motivation and strangulation. In case they are the no ambitions, indifferent about the futures, and loss of interest in the study. We can find in materia medica as in phosphoric acid, mental debility, and apathy. In baryta curve, we found that the developmental immaturity. Also, we find and in repertory in Kent, the apathy of the where is the number of medicines is the given, and also one cross reference also given, that is the that is indifference. In synthesis repertory, we seen that elements from ambitious loss of, where we found in the sepia, sulfur, ambrosia, and such type of medicines. Another thing, and there are also another rubric in repertory, elements from ambitions, loss of, and subrubrics discouragement and from. That is the medicine is a single medicine is a nux vomica is given there. Now, next slide, please. That is the next is integration. Third point of our mental health concept is integration. We already all know about the integration. Today, all our world and society are mostly proposed that the integration, integrated therapy, integrated study, and other things. Most of the what is the integration? This is the adaptation. This is the adaptive responsibility. This is the ability to adaptive response to environment or the situation, which help the individual maintain their anxiety and manageable level in response to stressful situations. That mostly help us. The emotional stability is the good sign of the that while we attending any function or any by some little of talks and contradiction, we've seen that there is some emotional instability, and they rushes with each other. So as a disrupt of these senses, we've seen that conflicts is the biggest role, and impulsiveness and sudden anger, remorse, such type of symptoms we get from this point of view. We've seen again from the repertorial aspects, there is a rubric of the contradictions. Contradiction, not a contradiction, is a sub rubric. Anger from contradiction, there is a and also a will against contradictions, and more tearful contradiction from such type of rubric. We find the will against contradiction, like in our materia medica having anacordium. There is a two wings in two shoulders. Also, there is some contradictory medicines like an ignatia, lachesis, all are there. Now, with the adaptation, next slide, please. Now, this is the autonomy. What is autonomy? Autonomy is the is our individual ability to perform independent, self-directed manner and making choice and accepting responsibility for the outcomes. There is the here why here the person can take responsibility of his own work and can make a decision. And most of the time today's life, we are the most of the time is the confused what to do, when to do, and anything. We are the influenced by other persons also. While we are clearing about our decisions, and we have an enough information and we have a rational mind, and two, we can easily take a decision, and the responsibility of our decision should be on our regardings, and that will be make person more confident and confident. And so, if those person are not take a good confidence, they are the most of the time is the lack of confidence. They find cannot take decision as well. We find in the synthesis repertory mind delusions, support himself. He could not support. He could not support it. There is the medicine of tobacco and mind anger consoled when. And another interesting rubric regarding this seminar, I find that in mind and confidence wants of, and the self confidence support from the family and family friends from this rubric represent that the person are the wanting the support from their family for that confidence boost up, and the medicine is given. There is a mac mu in it. And next please. Now the another point is the perceptions of reality. This is the we all know, we all have an perceptions, and each have an all have the perception, and which we have an our own point of views. This is the reality. We believe everything, we can imagine everything, but in reality we in environment without the distortion of that environment, and as well as the capacity to empathy, social sensitivity and respect concern for the ones to need needs of others. Just here we see the picture. It is the our regular day to day work that we see that while we traveling in a bus or train, there is a in while is a, that is the office time and in hurry, we want to after running in getting the bus or train, we try to sit the place, and we find the where is the any vacant place or something, and some people are not willing to adjust for that seat, especially for the train is the fourth person is the who is the wanted to sit and something. They think that there is a some places or patient or some person or tell that there is a no place. But if we adjust it together, then we can easily sit it on there. That is here it is the representations. Uh, Here the distortion and or imaginations and case taking and fear of imaginations thing is the immorality remedy. We see there is a in an organon our moral remedy in aphorism 17 also. There some belief system may be responsible for their perceptional changes. That is the why we if we distorted some delusion and imaginations related rubrics we can find. In case taking, there is a fear of imaginary things and the suspicious, where it is we found in Metamedica correlate with the hyoscyamus and Belladonna in hallucinations and rubrics like the delusions. And in Kent, there is a delusion, the single rubric which have the correlate to you also, and the hallucination, imaginations, and illusions, all of things. And Patak repertory have an rubric of perceptions related rubric, direct perception related rubric. There is a number of medicines is there. Now, next, environmental mastery. The fourth, environmental mastery is an indicator that suggests the individual having achieved the satisfactory role within a group, society, or environment. He is able to love and accept the love of others. Environment here we try here a person while his everything is okay, then they think and that they are the is not life for own self, not live for the only for own self, they live for others also. It is the main motto for it. While we are thinking for own self help and distorted, in not satisfied this case point, poor coping, maladapted, avoid responsibilities and anticipation will be there. They may illusion that he will be a superior, or in we find in rubric as a repertory he guide us the help for the selection of medicine, the anxiety about future, mind, company, aversion to avoid the sight of the people, and delusions and others medicines. Now, come to the this all things, all 6 points I delivered regarding the mental health concept, and how it is the correlated with our day-to-day practice and day-to-day lifestyles also. And I try to how it is distorted, and how the person coming with the symptoms, and they will manifest it, and how can we get isolated from it. Yeah. Now, come to the another part of this seminar, that is the mental hygiene. Before going, next slide please. Before going to the mental hygiene, before going to the mental hygiene, I would like to ask one thing, that that the how many days we keep that garbages is, or for garbages in our house for so long. Most of the time we all are accept that 1 day hardly or 2 day, because that garbages is this garbage is dirty, and the smell of the home is very bad. That is why we do not want to garbages in our house. Garbages is always dirty. So if garbages is so much dirty, but in our mind, we 2 days after, still now the conversation, we hope we accept that the body, the house of mind is our body. So while we thinking that the anger, the emotions like hatred, jealousy, and other so and so negative thoughts, that is the keep in mind for after a long times, after a long, if we keep it in our mind, how that will be the cleanse our body and systems. How it will be help us. Now, it is to our responsibility, our responsibility to clean that emotions, not keeping in our mind, but to solve it within first 24 or 48 hours. If it is not serious enough, to leave it as a garbage. Because the brooding of such type of emotions, and that mostly are trigger our autoimmune disorders, and that susceptibility also increased, that regarding the our disease is the like hypertension and lifestyle disorder like diabetes mellitus also, they are not in control in our health. So we must take responsibility to our mental happiness, calmness, and we do to irresponsible behavior and obstinacy. If we leave those emotions, then we hope better than today. Now, come to the our mental hygiene. So we already giving that example. What is mental hygiene? And mental hygiene in consist is the this is a science by which the is the auxiliary measurements that help and balancing and adjusting the health to development the personality. Next, please. The definitions of the mental hygiene consist of measures to reduce the incidence of the mental illness through prevention and clear early treatment and promotion of the mental health. Here, next slide, please. Mental hygiene also denoted it as a 5 points: the prevention, preservation, and curative measures, and balanced development of the personality, and leading happy and content of life. Now, we just discussed among those 5 points how it is the help to maintain our mental hygiene. Now, prevention. Next slide, please. Prevention. Prevention is the prevent the mental illness are. we most of the time how to prevent. So most of the time the prevention, the identify the causes and avoid that in social level or personal or anything else as like an obstacles to recovery in and also as a maintaining cost, maybe it a possibility. So we cut the cost. Every intelligent physician must remove the cost if where it is exist. So if possible to remove it, suggesting way the means the achieving the emotional and social adjustment. Next, please. That is the preservations. Now, after the prevention, and if not possible, the preservation, the we can one can enjoy good mental health if suitable care is taken for it and preservation and promotion. How it is possible developing the inner potential by the maturity and stability and achieving personal and social security and adequacy. We most of the time they seen that we are the most of the time the insecure. That insecure feeling most of the time is responsible for another stressor factors for our health, and that mental health is represented by our body language and behaviors. That is why we must secure our positions and the sense by the emotional maturity and the stability. And while we doing that, we already promoting our human relationship and good interactions. Now, next part, next slide, please. That is the curative measures. Uh, curative measures is a totally part of most of the time is the therapeutics parts regarding the one cured easily as early as possible the mental illness and disease he is suffering from. And here we advised to most those person are developed some disease and complaints. They are the most of the time suggested for the therapies and the treatment like an homeopathy, counseling, yoga therapy, and other modes. And also suggest the methods of the rehabilitation and readjustment mentally ill person. Now, the next slide, please. Now, this is the balance development of the personality, humor, harmonious personal growth. Here we, from the heading, we can already understood the personally development is the balanced way. The key of the individual adjustment oneself and environment. Lack of balance development in all aspects of the personality resulted of the maladjustment and unhappiness. It's because emotional stability and developmental is necessary for it. As an example, we all very well known on god of cricket, that Sachin Tendulkar. He have an once upon a time in childhood friend is a Vinod Kamble also. Oh, Vinod Kamble, who is the very much talented, as talented as Sachin Tendulkar. But due to the our surroundings and our personality not developed adequately, but that iconic figure, iconic person we lost from the Indian cricket as like that. Next slide, please. So drug addiction and like that things, most of the time, the balanced development of the personality is the hindering of that process. Now, next slide, please. Leading in a happy and content life. The ability of an individual to lead it a fluid and happier life directly proportionately to the mental healthy enjoyed by him. Thus, an individual must always strive uh, to get along with himself and his environment well and avoid unnecessary anxieties and conflicts and frustration. They are person most of the time he nourished the positive relationship, values of self, and living in alignments. The percent is the percent may recovery from that. at mental health. Those all are the mental hygiene. How the mental we avoid the mental health keep and mental health keep healthy. Next slide, please. Now, what we read or taught up to that, the some mental healthy mental health concept, and we see the such qualities and characters is having the person, the mentally health person, ability to make adjust, a sense of personal oath and feel oath, and make his own decisions, sense of personal security, sense of responsibility, and he can give and accept the loves and lives the in a world a reality rather than the fantasies. Is continue second next. So the emotional maturity develops a capacity to tolerate the frustration and disappointment, and how to react with the society, and meaning of purpose of the daily activities is, and he has variety of interested and generally well balanced life and work, and those all are the presented in mentally healthy person. Now, the warning sign. Next, please. Now, uh, uh, hello. Next. Oh, the symptoms of the mental disorder vary depending on the type of the severity of the conditions. We can categorize several symptoms from the according to ages. I try to put few symptoms here. Next, please. In younger child, we find that the perform, especially the school performance, we can see that the deviation of the school performance, poor get despite of strong efforts, or an excessive wrongly or anxiety and hyperactivity, persistent nightmares and persistent past aggressive behaviors, and frequent temper loose. So I can remember one of my childhood friend. I don't take his name. He is a very well in playground and also in educations also. But suddenly he stopped. They are continuing the schools, and that his perform coming after several days after, and followed by his performance in the exam become very poor, or how we friends and teachers thinks something is laziness or another issues for her his, we think about that they are not interested in study or something, but while their guardians are called for the from the schools, we connect that there is some familiar problems, their parental separational issue whose is there, that separational issues always not, it is regarding that our only the our problem, our surrounding also influence our behavior and our development, that in case that that person, that boy, that adolescent boy becomes affected by their familial issues, and that is why their performance become the poor, or and after the counseling and after the getting the therapy, he came back after several months, and then after he is in a good place now. That is that I want to tell. That is that behavioral changes is the most striking for that. Now, next, please. Also, we found in the child and adolescent an inability to cope their daily problem and activities, changing in the sleep and eating habits. We most of the time they seen that the eating habit disorder also in adults, and also in adolescents age group, especially that the overeating or less type of that is there is a in our medicines, that is the bulimia, anorexia nervosa, such type of problem, and the body shaving related several complaints is there at that age group, that emotional point of view. Delay long lasting negative modes, and a poor appetite throughout the day, and frequent outburst of angers. Next, please. In adults, we find that the confusion of thinking, long-lasting sadness, irritability, social withdrawal. They do not attend any parties or any social function. Strong feeling of anger. They want to be living alone. On denial, obvious problems and thoughts of the some. If it is the trigger, most of the time loathing of life is the questionable for that time their thoughts about the suicide, and most of the time we seen that they are the some surroundings and peer group also one of the responsible. They may be lead to some abuse of the some substance like and drugs, alcohol, smoking, and others, etc. uh, Now, there is some guidelines related. Next, please. Some strategies are several ways as how can identify it and how to consolidate, like the individual centered intervention, child oriented interventions of the school, and such and such. Next, please. And secondary prevention also, after that, yes, primary, then we targeted people that the which person is needed for that type of complaint, and we treat it according to their symptomatology. Next, please. Here is a next, please. Here I want to give the ego with the defense mechanisms. Hello. Next, please. Uh, Here I give the ego with some defense mechanism, but I just touch it. It is a separate topic. Like, usually our behavior denoted from by these such of defense mechanisms, so like repression, projection, denial, regression, sublimation, and displacement. And here also a classification. How the Freudian concept id, ego, and superego is also related with that. And I just touch on that point of view. Next, please. Next, please. The frustrations. Frustration is the every action arises in response to in response to need and is directed towards the goal. Or frustration is an emotional state. Next, please. Frustration is an emotional state experience is when an individual encounter obstacles and preventing them from the achieving their goals and fulfill their desire and satisfy and their needs. Now, here we already know that the Latin word of the frustra meaning the obstruct. So while there is obstruction, most of the time developed our frustration. Then frustration leads some conflicts, and that will also depend. Next, please. Uh, uh, our root behaviors, and here is the some few point of the cause and sources of the frustrations: external factors, social factor, and economical factors. So physical factor, external most of the time is such a physical factors of natural climates. Something, some rituals and beliefs systems may be related with the social factors and financial problem. One person want to travel anywhere most of the time, but due to the financial cost, they do not go to there. The most of the time they develop the frustrations. And another important, the after the external factor. Next, please. That is the internal factors, the physical abnormalities and defect, right, where the our deformity may leads to our inability to perform and a healthy life. That is the internal conflict of that person, and most of the time they motivate to doing thing as a normal life. And a high level of aspirations of us make disappointed while we not achieving that. Lack of persistence and the sincerity in efforts. High level of appearances like and we have in some medicines like sulfur, lycopodium, tuberculinum, and such, and etc. Now, reaction. Next, please. Reaction of frustrations. We can get the some symptoms. which is also related as defense mechanisms, the restlessness, tensions, apathy, and stereotypic behaviors also. Now, next, come to the conflicts. Conflicts means it's a painful emotional state which is result from a tension between the opposed and uh, contradictory wishes. That most of the time we are in this section. Most of the time we are responsible for it. The conflict keep most of the difficulties to us for the level of stress is stress. Um, Now, the type of conflict, just I touch it. It is next, please. Next. Approach conflict, where the person is forced the two attractive alternatives is while only one of them is selected. That someone approaches that conflict usually that like an alternative choice. Both are the is my favorite, but I can choose one of them. That is the most of the time that the decision making confusion that conflicts is related to the approach to approach conflicts. And it is not severe if the second one is the more attractive and more or close to person. Next, the avoidance conflicts. This is the arises person to undesirable situation and avoidance. One force exports to the others. That the one person example choosing between the surgery or radiation treatment for the cancer, or choosing between the lower salary or a work or unemployment. These burning issues also. And another thing, avoidance conflicts. This is the arise when next please arises when and one event or activities both attractive and unattractive features. Example, some ice cream is so delicious, but it also causes obesity. Most of the time we see. And next, please. But most of the most conflict is come from the multiple approach avoidance conflicts. Here is a multiple alternatives has a both positive and negative features. Such conflicts are the most difficult to resolve and make right decision. Individual must analyze and accept the value of the each action. It is the very difficult to resolve the person. Next, please. Internal another thing is a internal conflict. Internal conflict is the most important part. Freud described it as a conflict between the three dynamic aspects one's personality, that is the ego and super ego. And conflict is the unconscious level and responsible for the many of our emotional disorders in the mental diseases. Internal conflict is a more important role play in our life. What we always think what to do, what not to do. Now, next, please. Here is some measurements regarding this point of view. The identify the sources, the how to overcome the conflicts and frustration. Decide importance, which one is the importance thing. Review and change and modify. Substance, take more information. Avoid the indecisions and such and such. Next, please. Now, it is to our mental health strategies, so promoting the different several ways we can and we can and visit it for the mental. Next, please. Next, uh, there is some places where the mental illness can treat it. Like and such and government medical voluntary organizations and such and suicide prevention is the one of the important part and district rehabilitation center and etc. Next, please. Now, government also have in India 47 mental hospitals. Among that, three are the some from the central government area. Next, please. This is an next, please. This is an a pictorial presentation. Mumbai Medical College is a first medical aspects, right? Where the our mental health hospital is first established. Second in Calcutta, and this is the plan and of regarding the government working in India, especially most of the time 2020 after COVID situation, our mental health is exposed most of the time. Why? Because we are in quarantine. And Kiran Helpline is that their national tele mental health program. And another very important and very role play is in 2023 the tele manas expanded, and now Ayushman Bharat, where is the have an 2024 Ayushman Bharat mental health service and integration and all other services according to the yearly is presented. Now, next, the just key point to how the mental health keep with our skills. WHO gives these 10 skills, self self-awareness, empathy, critical thinking, creative thinking, decisions making, problem solving, and effective communication, interpreting interpersonal skills, and coping coping in the coping. Next, it is a few questions checklist. Uh, Checklist regarding this. Before concluding, I would like all please read those questions and try to make out in yourself, find yourself that concluding. Before we conclude, I would like to leave a one simple thought, or one simple thought make you the push think about your patients and emotions, not just their symptoms. Then and we have already taken one step towards the thinking. The mental health, next please. Mental health is not a sin but deeply felt, and mental hygiene is not thought but lived. Homeopathy heals the where it is the what fail, the silent suffering of the mind. Thank you. Thank you. Over to Sir Dinesh sir.
A very thank you and congratulations to you, sir, for a informative presentation about mental health and mental hygiene. You very well tell about the concept of mental health and how to combat this problem. And now, so we have just 1 minute. So, if anyone have any questions regarding mental health,
Yes,
uh,
yes,
Yes, sir.
it's really a very good session. You really rock the floor with your knowledge and with your what a beautiful slide preparation also. Your PPT was so excellent, pointing out each and every point in a better way. Each and everyone can understand the same thing in a better way also.
uh,
Because
sir, Dr. Ram Parvesh sir raised hand. Maybe he has
okay,
a question.
okay,
Thank
sir.
you.
Please.
Thank you.
Okay, sir.
Thank you, everyone. Namaskar.
Thank you.
Congratulations.
Thank you, sir. Thank you.
Congratulations, Dr. Amit Gunin. Very nice,
Thank you, sir.
excellent session. Very knowledgeable session and knowledgeable presentation. Mental health. Mental health, according to homeopathic, mind ही सबसे mind mental disease treat the patient. होम्योपैथिक जो है रेमेडी एंड मेंटल हाइजीन परमानेंट क्योर अकॉर्डिंग टू
Yes, sir.
होम्योपैथी
Sir, we
तो
are running out of time.
Yes,
Now it's time to hand
yes,
over.
thank you.
Yes, tomorrow we will have a session from Dr. Rishita Shah, and the doctor will be talking about mental well-being as pillar of Vikasit Bharat, insight from homeopathy. Hope all of you will join this meeting tomorrow. Once again, thank you, Dr. Amit
Thank you,
Gunin,
sir.
for
Thank you, sir.
coming over, and thank you, Dr. Rishita Tiwari, for your excellent
Thank you,
information.
sir. Now,
Thank you all the participants for joining the session. Thank you all. Good night.
Thank you. Thank you.
okay. Now we are forwarding to Malayalam team,
Yes.
and
എല്ലാവർക്കും നമസ്കാരം. IFPHന്റെ 2034 ദിവസത്തെ മലയാള വിഭാഗത്തിലേക്ക് സ്വാഗതം. ആദ്യമായി ഒരു നിമിഷം മൗന പ്രാർത്ഥന. നന്ദി. ഇന്ന് ലോക നാടക ദിനമാണ്. ഒരു നാടകവും ഹോമിയോപ്പതിയുമായി എന്ത് ബന്ധം, അല്ലെങ്കിൽ ചികിത്സയുമായി എന്ത് ബന്ധം എന്ന് സാമാന്യമായി ഒരാൾക്ക് ചിന്തിക്കാം. പക്ഷേ ഹോമിയോപ്പതിയുടെ മെറ്റീരിയൽ മെഡിക്ക എന്ന പുസ്തകത്തിലെ പല മരുന്നുകളെ കുറിച്ച് നമ്മൾ പഠിക്കുന്നത് ശരിക്കും ഡ്രഗ് പിക്ചർ, ഡ്രഗ് ഡ്രാമ എന്ന് തന്നെ ഉണ്ട്. കാരണം നമ്മുടെ മുമ്പിൽ ഓരോ കഥാപാത്രങ്ങളായി ആണ് ഓരോ മരുന്നുകൾ അവതരിക്കുന്നത്. അതിന്റെ ഇപ്പോ ഫിയർഫുൾ എക്സ്പ്രഷൻ, മുഖത്തെ ഭാവം തന്നെ, കൗണ്ടൻസ് ഈസ് എക്സ്പ്രസീവ് ഓഫ് ഫിയർ എന്ന് പറയുന്നുണ്ട്. ഒരു രോഗിയെ കാണുമ്പോൾ അദ്ദേഹത്തിന്റെ മുഖത്തുള്ള ഭാവങ്ങളെ ഒപ്പിയെടുക്കാനുള്ള ഒരു ക്യാമറയായിട്ട് അല്ലെങ്കിൽ സംവിധായകന്റെ കണ്ണോടുകൂടി ആയിരിക്കണം ആണ് ഓരോ ഹോമിയോപ്പതി ഡോക്ടർമാരും കാണുന്നത്. അപ്പൊ അതുകൊണ്ട് തന്നെ കലാരംഗത്തെ കലാകാരന്മാരുമായി ഹോമിയോപ്പതിയുമായി വളരെ ബന്ധമുണ്ട്. ഹോമിയോപ്പതി ഡോക്ടർമാർ പലരും